One word, fantastic. Literally everyone we have come in contact with. I already mentioned Morgan, our lung transplant nurse, who did our patient education mid-April and then guided us every step of the way until that day she made the call for us to come. I already mentioned our calls with Dr. Che, Dr. Kurihawa. Dr. Kurihawa was eventually the surgeon who performed this miracle and literally saved my life. And then Dr. Tomich from pulmonary, Dr. Arun, Dr. Myers, all from pulmonary, have provided constant care. Dr. Tomich, when I was here for 2 weeks in April, I got to see him every day and updated me on all my results, and the one who eventually told me that, we're welcomed into the study. But the aftercare has been amazing, and literally every nurse I had in ICU, in the step-down unit, the care here has been literally world-class. And I'm so grateful. Everyone has been fantastic. Well, as I was saying, as good as that care was, it just makes it so much easier to accept what's happening. People would explain everything. I had so many questions, and nurses, doctors would give me explanations. They provided such loving care. The nurses, especially the overnight nurses, my gosh, what they do over there is amazing. And so with all that care, all that positivity around me, it makes it that much easier to be positive myself and to realize I'm healing. They were so encouraging. Every time I was able to get myself out of bed, or when I started walking the halls after surgery, everyone was so positive and encouraging. It just makes you want to heal. And I think that was something I'm super grateful for too. I'm going to say that day at the end of those, I think I was here 2 weeks in April, when Dr. Tomich came into my room after the last test, and he said, you've passed everything. We are inviting you into the study. And all that encouragement from my wife for years saying, hold on, we will find an option. It's like it all came together in that moment and said, you are not going to die. You are going to get new lungs, and this is all going to change. So I think that moment when Dr. Tomich said, we're good to go. Do you want to do this? Yeah, I think for us, it may not be a moment so much as the process of waiting so long. And in that process, so I want to say, I think it was day 55 when Morgan first called us and said, we have lungs for you. Now, they are hepatitis C, and we had already agreed to take hepatitis C lungs because it is curable. It's not ideal, but we were told that we probably would get lungs quicker if we accepted hep C infected lungs. So she did call on that Friday, said we had these hep C lungs, get ready, come to the hospital. So we started frantically packing and getting everything ready. And, the excitement of finally getting this phone call. But within 40 minutes, Morgan called back and said that not only were the lungs hep C, but they were testing them for HIV, because a lot of these hep C lungs, of course, are coming from drug users. So they test for HIV. And she said that repeatedly they had tested these lungs, and the test kept coming back inconclusive. So she said there was no way to rule out HIV, and they're going to have to pull the offer back. That was tough. We'd heard about what they call dry runs. Sometimes you don't know till you're right going into the OR. We only had 40 minutes of excitement before our hopes were dashed, but it was definitely a down moment. And then it was 5 days later that Morgan called again, and this time beautiful, healthy lungs, no hep C, no HIV, and it was worth the extra 5 days to wait. So I mentioned Dr. Tomich inviting us into the study already. I think another encouraging moment was when I woke up finally in ICU and I was alive. And I had no oxygen, supplemental oxygen. I was in a lot of pain. I looked like Frankenstein. I had tubes and IVs and chest tubes and catheter and central lines. And I mean, it was unbelievable what they had me hooked up to. But I was alive and breathing and knew at that moment I have potentially many years to live with my beautiful wife and enjoy our family and travel and all those things that seemed like were never going to happen. So hugely encouraging moment in ICU. Yes, and this would probably be the only thing that we would maybe suggest to the hospital that you incorporate more. We were really kind of frustrated during the waiting period when I was getting more and more sick. I could not lie down because I would cough like crazy, so I couldn't sleep. It was almost over 5 weeks that I didn't get any sleep. And when we told people, doctors at the hospital, this is what's happening, the answer we got back was, yeah, this is a really tough part of the journey. When we talked about how much mucus I had, that I literally felt like I was drowning in my own mucus. Again, the answer was, yeah, that's one of the indications of the lung cancer. It's really tough, but no help, and this is the only thing I would say was a little bit discouraging, is that when we asked these kinds of questions from the hospital team, the answers seemed to be too limited to Western medicine and finding a pill or a procedure. When I was in the hospital in April, they put me on CPAP for sleep apnea, and they were able to hook the oxygen, the supplemental oxygen, to the mask. So I could wear that at night, still get the oxygen, and it was the first time I was able to sleep. Well, I begged for a mask like this when I went home so I could get my oxygen at night and sleep. And we were told, I'm sorry, the hospital can't issue that sort of equipment, because I did have a CPAP at home, but I had like a nasal cannula, and that wouldn't work with the oxygen. I needed a mask with an oxygen adapter. So we begged for it. I even had one of the respiratory therapists try to rig one up for me, but the hospital couldn't provide that, and said that the only way I could get a mask would be through a sleep study, which of course I couldn't do at the time because I was dying and I was on oxygen. So that was frustrating too, finding out there's a solution to me being able to sleep, but no one's able or seemingly willing to provide it. Who knew? My wife went out on Amazon, was able to get a mask on Amazon and a $1.50 adapter for the oxygen. So we ordered it and I used it, and for the first time again, I could lie down and sleep at night because she took things into her own hands. The other brilliant thing she did is that she got absolutely frustrated with nobody being able to help us with all of this coughing and mucus. She went out on YouTube and found a video of a nurse showing what she called percussion massage, where she would cup her hands and pound like this on my back for 5 minutes every morning and every night. And that literally broke up the mucus in my airways so I could get it out and I could breathe. So there was this feeling of like, how are they not recommending this to all of the patients who are just struggling and struggling, and then just being told, yeah, this is a really tough part of the journey. So that was frustrating. We don't blame anyone for that. They're real and they work, and patients need them. So, we hope that, well, I'll mention, from my wife Lori's interview last week, she's writing a book about all this. She is a brilliant, gifted author, published already, and she's been keeping track of all of this. We were told in our initial meetings here with Northwestern that we should start a GoFundMe campaign, which we did, and we are so grateful for unbelievable outpouring of love, letters, financial support that's come to us. But Lori is updating that all the time. And that's how she realized, in sharing all this information with people who've been so grateful for it, who some of them know people who have lung cancer. They want to pass that on. Do not give up hope. You know, no matter what we're being told, no matter what the circumstance or the diagnosis is at the moment, don't give in to that. You know, she kept saying, right, hold on, you never know. New medicines, new procedures, and she was right. 2 years later, I got on that Tagrisso. 2 years later, this double lung transplant became available, which 2 years ago had never been done. This solution did not exist for late-stage lung cancer patients. So when Dr. Barat here pioneered this 2 years ago, suddenly an option became available not just for me, but for many others that had not been available just 2 years prior. So definitely the biggest lesson was do not give up hope. Hold on. Stay as positive as you possibly can. Try not to give in to the fear, because it is scary. There are a lot of emotions that happen when you're told that you're not going to live. Hold on. Yes. You know, as a student in particular, I think you spend quite a bit of time, as you need to, in books, in class, being taught and mentored. It might become easy to focus on the academic and the intellectual part of the medical profession. And so the advice I would give is to remember that on the other side, you're dealing with real human beings who are facing end-of-life issues, who do care, as I did. I had questions about what was happening and what the procedures were, but at the end of the day, that was so less important than facing emotionally, psychologically, the fact that I'm dying, that I'm not going to be with my wife anymore. Get to see my boys possibly get married and start families of their own. So just a reminder that this is the kind of stuff, I mean, you can see how emotional it is just thinking about it. This is what your patients are dealing with. And you have to have the academic. You have to have the intellectual. It's what makes the world-class healthcare here so amazing. But always remember you're dealing with real people, with real feelings, and combining that care is, I think, what's so important. Well, it's just reiterating the message that I learned from my wife. Never give up. Never, ever, ever give up. Because you just don't know what's coming. And the longer you can keep yourself going, the longer you can be positive, the longer you can take all the steps you need to take as good care of yourself as you can. And hopefully you have the kind of amazing caregiving experience I had with my wife, who was just a rock for me. I literally would not be here without her. I could not have made this. It was so challenging. So my encouragement to you, if you're struggling like I was, is just to not give up hope. Because again, you never know what's coming down the line. And you might, and I hope you do, have the experience that I had, that your life could be saved by something as miraculous as this double lung transplant they're now doing and perfecting here at Northwestern Medicine.